discussion the code purple item from the consent agenda, just so we can kind of take a few minutes talking about the context around that.
All right, very good. So let's get started, and we're going to begin with a COVID update, and Stacy Saunders is going to present this item.
And we'll see it up there? Yeah? Perfect. Great. Thanks, Kirby. Good afternoon, commissioners. One of the things I'll just comment very quickly as we adapt to this this setup, that the last 2 years have taught me that you are just going to have to be adaptable to things. So please bear with me, as there's lots up here today. So thank you, commissioners, for the opportunity to provide this update to you. I did want to just start off and say, since the last time I presented to you at the beginning of January, we've experienced a very large increase in cases. We had added about 12,700 new cases to our total in the last month. That's about 410 cases per day and almost 3,000 cases per week on average. In 1 week, for example, alone, we added almost 4,000 new cases. With the recent surge, Buncombe County has now reached a total over 46,000 total cases of COVID-19 identified since March of 2020. You can see here I've started off with our epi curve. This visual shows our COVID story in peaks and valleys. It is clear as you look toward the far part of the curve that the Omicron surge has been rapid in its climb and intense in its burden of cases. However, I do have some good news to share with you today as far as recent trends. As you can see at the far end, and if you focus in just a little bit, we are starting to see a decline in new cases. Last week, we were experiencing 907 new cases per 100,000 per week, which was a significant decrease and somewhat impacted by the winter weather and holiday that we had, because throughout that week we saw it rebound a little bit and go up to the mid-900s. But as of yesterday, when we did the week-to-week analysis, we see that as of yesterday, our case rate decreased to 875 new cases per 100,000. And this rate continues to decrease today when I looked at the dashboard before I came in to the meeting. So this is good news. While there is still considerable spread and we are still clearly in a community with high transmission, cases are anticipated to decline quickly. Additionally, the percent positivity has declined for the first time since mid-December. For the last week or so, we have been experiencing a percent positivity of well over 25%, and most of the time in the mid-25%. This week, we find the percent positivity around 24%. While the case rate and the percent positivity are showing signs of decline and signs of hope that the surge may be dissipating, hospitalizations and deaths are not yet showing that same decline. This is not altogether surprising. You've heard me say before that our COVID-like illness is our first indicator, followed by our case rates, and then our hospitalizations and our deaths tend to be lagging of those case rates. So here, what you're seeing is the Western North Carolina regional hospital data that is showing a continued increase in inpatient beds occupied with COVID-19 and a steady increase in ICU utilization. Specifically for our Mission Hospital system, we have recently seen high stabilization in the inpatient beds with COVID-19. Over the last several days, there have been anywhere from 181 to 188 COVID-19 positive inpatients across the Mission Health system. So not just Mission Hospital located here in Asheville, but across the system. And just a reminder that across the state, about 70% of hospitalizations are in those who are unvaccinated, with only 5% of those hospitalizations in folks who are vaccinated and boosted. And about 79% of ICU utilization across the state is in the unvaccinated. Additionally, 13 new deaths have been reported to the dashboard, bringing our death rate from 4.2 deaths per 100,000 per week last week to about 5 deaths per week per 100,000 per week this week. We now have lost 488 neighbors to COVID-19 related deaths. Again, as cases continue to decrease, it is likely that the hospitalizations and death may also begin to see a decrease in the next several days to weeks. And so what I have for you now is our metrics that we've been following since October of 2020. And just to summarize the metrics, while cases and percent positivity remain high, they are beginning to show signs of decline. So this is encouraging. Hospitalizations and deaths are seeing increases right now. We hope to see those indicators. Also, we'll experience a decline as cases further decrease and we find ourselves further down the curve of this surge. I am going to switch gears and talk about recent testing efforts to bridge the need for testing while cases are high and testing demand was high. Over the last few weeks, Public Health and Emergency Management have been working to obtain and allocate at-home, rapid at-home test kits and masks to the community. The purpose of this initiative was to create a temporary bridge for the community to access at-home testing while we were experiencing high testing demand, strain on testing providers, and while we work to increase testing opportunities in the county. We created a parallel path of distribution for the at-home test kits that provides a dedicated arm of the initiative to equity and another arm of the initiative for general population. The equity focus path identifies community organizations who serve populations in one or more of the 3 equity domains, being historically marginalized, low income, and or rural communities. Each community organization then received an allocation based on the population they serve, including high risk of exposure or high risk of severe illness, geographical location, etc. Community organizations then were provided agreement, just like what you'll hear on the general population side, picked up their allocations and have begun to distribute to their clients, to their population through events that they support, like food markets, community centers, homeless outreach, homebound, and other mechanisms. As a result, 34 unique organizations were allocated about 5,100 test kits and 15,000 masks. These included rural community centers, homeless service providers, churches, community health workers, Latinx outreach, and many more. The second arm of the initiative is focused on providing opportunity to the general public to the at-home testing resource. This involved identifying partners that could function as fixed sites throughout the county for distribution. And in order to best serve the general population, we identified fire departments, libraries, and the health department. Using this approach allowed us to have geographical distribution throughout the county, north and south, east and west, and central. We ended up having 18 total locations, 14 fire departments, 3 libraries, and then the health department. The fixed sites have distributed over 6,600 test kits and 12,000 masks. So I just wanted to take a moment to personally thank all the community partners, all the community organizations, the fire departments, the libraries, and the 40 Cox staff for their participation, assistance, and support in getting this resource out to the community. Just to spotlight some of that great work, in particular, Broad River Fire Department actually utilized some of their at-home test kits for the homebound in their community and delivered those to the doors of those individuals. The Asheville Fire Department partnered with Shiloh and Stevens Lee Community Center to provide distribution at those centers' location for ease of access and better reach into the community. And a couple of our rural community centers are utilizing their kits for food security programs that they support, they operate to support those community members. So again, many thanks to the multitude of partners and emergency management, especially Brittany Robinson, who tireless efforts to help support our public health response. While implementing the at-home test kit initiative, we have been working to increase the testing capacity and opportunity in the community, especially while the demand has been so high. Our community added Optum testing provider, a North Carolina Department of Health and Human Service testing resource, to the testing provider list. Optum began providing testing services at UNCA campus on January 21st. And they provide testing from 1 to 8 p.m. on Fridays, and then 9 to 5 on Saturday and Sundays. And we anticipate that Optum will be in the community until at least February 20th. The existing North Carolina Department of Health and Human Services testing provider StarMed is also expanding their footprint in the near future. Currently, they are providing services at Harrah's Convention Center, but are planning to migrate their services to a larger space at the Asheville Mall in the coming weeks. Once migration is complete, StarMed will continue to provide services at Harrah's for large events. In addition, StarMed is looking at also adding another day to their AB Tech pop-up testing events, and that will be coming in the coming weeks. So we continue to have a multitude of testing providers listed on the North Carolina Department of Health and Human Service Find My Testing location website. And there are now an increasing number of at-home test kit opportunities, including the recently launched federal program where each home can receive 4 tests by mail. So folks can visit covidtest.gov. And I can say it's pretty simple. Of a process of entering your name and your address. No other information is needed. And just a reminder that folks who are registering for these test kits, that if you live in a multi-unit housing like an apartment, make sure that you do put your apartment number or your unit number. That's really important. And I want to also just say to our community organizations, churches, and others that for folks who may not have internet access or don't find technology easy to use, that please think about helping folks sign up to get these tests. There is also a phone number or a phone option if folks do not want to use the website. Additionally, individuals can receive an at-home test collection kit, so not a rapid test, but a test collection kit that you would swab, and then you send that off and get results usually in 24 or so hours after shipment. You can receive those from the North Carolina Department of Health and Human Services by visiting either their North Carolina Department of Health and Human Services Find My Testing location website or visiting ondemand.labcorp.com/NC. And lastly, I just wanted to mention that more and more local pharmacies are replenishing their stock of at-home rapid tests. Just this weekend, I stopped into a few pharmacies just to see what did inventory look like, and there are several that have tables and shelves totally stocked. So, please think about some of the other opportunities that you also have for at-home rapid testing. And recently added that at-home test kit purchase, the over-the-counter at-home rapid test purchase can be covered by insurance, with the exception of some Medicare plans. So please check with your insurance plan provider and the pharmacist that may be covered by your insurance plan or reimbursable. And now I just would like to spend a little time on vaccine efforts. That we did see a slowing in the uptake of vaccine with the holidays and winter break that coincided with schools being out. But I did want to share that right now 72% of our eligible population has received at least one dose, and 69% of our eligible population has received their full primary series. So just a reminder that we're very close to reaching that 70% stretch goal that we all had talked about many, many months ago when vaccine administration first began. Over 94,000 individuals have received their third or booster dose, which is about 55% of that full primary series population. So now with the holidays behind us and we still have high transmission, now is a good time for folks to start their series or get their missing dose. And folks can visit us at a community vaccination event that we have planned for Saturday at T.C. Robertson High School. That's February 5th at 10. And you can get your booster dose, you can get your first dose, you can get whatever dose you need at that event. Additionally, we continue to hold our vaccination clinic at 40 Cox. We have seen that demand at the 40 Cox mass vaccination clinic has decreased over time and anticipate that by the end of February, we will be able to transition that COVID-19 vaccine clinic into our regular immunization operations at the health department. I'll have more to come on that information as we get closer to that transition. And then lastly, just some key points and takeaways for folks at home around that. Yes, cases are beginning to decline. It's still important to protect ourselves. If you have symptoms, please stay at home. Call your provider, seek testing at one of the testing providers. Make sure you stay at home for at least 5 days if you're symptomatic or your test is positive, and until your symptoms are getting better and you have no fever. Please remember that vaccines are working to prevent severe illness and hospitalizations and death, and consider getting the dose that you might be missing today and come visit us on Saturday if you need a vaccine. That's all I have for you today. Commissioners, happy to answer any questions.
Stacy, thank you, and that's really awesome to hear about the testing sites and mass distribution. That's fantastic work. I'm sure the community appreciated that. I had a question about vaccination data. Again, just to confirm my own understanding of where that data is coming from. I think you showed 72% of our county with one dose. As far as I can tell, the State Department of Health and Human Services has stopped showing that data on their tracker and is using the CDC data. I guess just help me understand where you get that number from.
So
I can.
Thanks for the question. North
Explain to
Carolina
people.
Department of Health and Human Services still pulls from their CVMS database. So that's the COVID vaccine management system that North Carolina created for vaccine providers in North Carolina who are not participating in a federal program. And what they do is they combine the CVMS data from North Carolina providers with the CDC data that is gathered and obtained from federal providers, whether it's typically that's going to be your Department of Justice, your Prison Bureau, your Veterans Affairs. You might remember a few months ago there was some issue with that data around the county of administration versus the county of residence. To my understanding, that has been corrected now, and that data still comes from the CDC. Tiberius is their database to the North Carolina, and all of that is combined. And then you have the federal pharmacy program where our large-scale pharmacies of Walgreens and CVS were participating and still do, and that data is also put in there.
Okay, thank you.
Hey, Stacy, were you able to check on the long-term and congregate living facilities and ensure that they were getting access to boosters? I had reached out to you via email, and I know that there was this one specific one, but I wondered if you were able to check with others and ensure.
Yes, so I can tell you that what I was able to find is that, yes, we still service the really small adult care homes and those groups through our fixed site, making sure that, our mobile outreach. The larger long-term care facilities in the beginning were serviced by large-scale retail pharmacies. The state has since put in some resources for them to be able to get their boosters and whatever doses are missing. And so we've communicated with the long-term care facilities again, make sure that they know that resource is out there and available to them. So, yeah.
Hey, Stacy. Thanks for the presentation. I had a question, maybe if you could comment on. So the the development of the new antiviral pills from Merck and Pfizer. are considered to be like a real, hugely important future tool going forward for folks who do contract COVID. The research I've read indicates that if people begin the treatment process early after developing symptoms, they could reduce hospitalizations for people who contract COVID by maybe 90% or so. At least the Pfizer version is that effective. They're still in sort of limited supplies now, but that's expected to be alleviated in the coming weeks and months. Kind of like, we're sort of like in the early days of vaccines, right? It's like
That's right.
more demand than supply, but that will change probably pretty soon. There is kind of a somewhat complex process though for people to get them, right? And the key is that people need to start taking them quickly after developing symptoms. So, I'm reading that there is some concern about whether, as the supplies become more readily available, whether a lot of folks who would really, really benefit from them may end up not successfully getting them in the small window of opportunity that they need to get them by to start taking them to avoid being hospitalized later. So I just wanted to ask, I know that the county is not a direct healthcare provider, but are there any things that we could do to potentially support, a system within the community to make sure that the people who would really benefit from them, which certainly includes people who did not get vaccinated, the elderly, people with other underlying health conditions that make them particularly vulnerable if they do contract COVID, so that they can get tested, get a prescription, and then actually obtain the medications within that matter of just a few days they have, which for folks who are working and are juggling a lot of stuff may be hard. I know some places, like there was media coverage this week around how in New York, people can kind of get qualified, get a prescription over telemedicine, and then they actually deliver the anti-COVID pills directly to your home, and all that happens in the same day. So probably pretty idealized system. They may be in a better position to do that kind of stuff since they're in that direct healthcare providing role, but just as an example of like a neat model to kind of speed things up. But any initial thoughts at this stage for how that's going to work in our community?
Thanks for the question. You're right. For Buncombe County Public Health, we are not a primary care provider, so the direct provision of that type of medical care would be out of our scope. But the concept of facilitating that in some way, or helping get that word out, is something that we could probably assist with. And what comes to mind initially is the safety net provider group that the health department already convenes. And we actually just met with this group, and many of those providers are providers who are listed on the North Carolina Department of Health and Human Services Find Treatment website as having either monoclonal antibody or antiviral therapies available. So I think I could probably take that back to the safety net provider group and sort of see what is possible around a concerted effort, at least around messaging and getting the word out to very vulnerable populations at the very least, to help them understand how to navigate that system. I will say that yes, right now the supply is fairly limited, although it is growing daily. And we do anticipate that at least by March, we'll start to see that increase more, and possibly more providers coming on board for that as well.
And so people, to get the antiviral medications, they need to get a prescription for them, right? So I don't know the exact statistics, but there's a fairly meaningful percentage of the community that doesn't have a primary health care provider, right? Like I've read statistics, maybe 25 or 30% of people don't really consider themselves to have that. So what's how would those folks access prescription and treatment?
Well, as I said, many of the providers in our community that are safety net providers are also federally qualified health centers or rural health centers, which are primarily poised to serve those who are underinsured or uninsured completely. And so that would be one of the avenues for an individual who has limited access or no primary care or medical home to be able to get assessed and then possibly get a prescription. First and foremost, it's about once you have been diagnosed or once you have a positive test, being able to get tested quickly, get that diagnosis quickly, and then be able to seek treatment and get treatment very quickly.
Okay. Well, thank you for that. I guess I would just say that, like, you know, I mean, to me, the development of those medications is probably the second most important, like, medical development, second only to vaccines, since this whole thing has happened. And so if there's anything the county can do to play a supportive role, logistically or otherwise, so that if we had enough now, right, and they were being accessed by people who could benefit them, I mean, these hospitalization numbers that we have right now could theoretically be a tiny fraction of what they are, right? So I just hope that we can create kind of that community system that really makes this really accessible and easy for people to get them who will need them. So anything we can do to be supportive, I'm certainly very supportive of. Commissioners, any other questions for now? All right, thank you so much, Stacy.
Thank you for your time.
All right, next up is the internal audit meeting schedule. And we have Dan with us. Welcome. Appreciate you being here. Welcome aboard.
Your PowerPoint, you're going
You present this item.
down and up.
Okay, well, good afternoon to the board.
Good afternoon.
Per today's agenda, we're scheduled to discuss the internal audit program, specifically the audit reporting process. We'll cover key items today, such as the internal audit program reporting structure, the cadence of the internal audit program reporting, and the relationship between the internal audit department, the audit committee, and the Board of Commissioners. So prior to jumping into our main topic at hand today, though, I wanted to introduce myself, as this is the first opportunity I've had to speak publicly to the full board. For those of you that I have not had the opportunity to meet yet, my name is Dan Kiser, and I am the new Director of Internal Audit here at the county. I assumed my role as the director on January 10th, and have spent the last 3 weeks familiarizing myself with county operations and processes. Prior to joining the county, I've built my professional experience both in an internal and external audit capacity, serving private and public company sectors, which include federal and state government organizations. I started my career as primarily an audit consultant, and have led the audit department for 2 organizations prior to accepting this role with the county in early January. I'm an active member of the Institute of Internal Auditors. I'm also a certified information systems auditor. Personally, my family and I moved to North Carolina from the Baltimore, D.C. area over 5 years ago, and we haven't looked back. In 3 short weeks in my new role, my main takeaways are that this is a committed workforce that is talented, motivated, and driven to provide excellent public service to the county and its residents. I look forward to partnering with this team and working to maintain a best-in-class internal audit program supporting county operations and leadership. Now, in addition to my background, I also wanted to share with the board at this time a few key strategic initiatives for the internal audit department, which will be the foundation of the internal audit program going forward. One is our mission. The mission of the Buncombe County Internal Audit Program will be to provide ethical, high-quality work driven to not only support the county, but to assist in identifying areas for improvement and efficiency as it relates to county operations. This is our commitment to our stakeholders. This includes, of course, the Board of Commissioners and ultimately our county residents. The primary goals of the Internal Audit Department will include striving to provide value to county operations in all work that we perform as a department. 2, we'll be executing audit work that's in compliance with national and government auditing standards. And 3, the department will strive to be a promoter of operational efficiency and compliance throughout the county. We will not only issue audit results, we will collaborate with department leadership to assist in messaging compliance throughout the entire organization. So now that we've had an opportunity to discuss my background, as well as touch on our mission, stakeholders, and the primary goals of our department, let's move on to the primary topic of today's discussion, and that's the important topic of internal audit reporting. So the first and arguably most important component of internal audit reporting in the process is the concept of auditor independence. So this is key, as the independence of the internal audit department and its program needs to be, including the transparent reporting of audit work, is critical to program effectiveness. Currently, the Buncombe County Internal Audit Department is independent of county operations, as the program is not responsible for overseeing or executing any functional operations within the county. In addition to being independent of performing operations, the program also maintains its independence through its direct line of reporting to the Buncombe County Audit Committee. This committee is independently chaired and is comprised of county leadership, including a number of our county commissioners. The Audit Committee has direct oversight of not only the internal audit program, but also the external audit work that's underway. This oversight includes the status of audit work performed, the results of audit work, and the remediation efforts associated with any opportunities identified for process change or improvement in operations. From a reporting cadence standpoint, the Audit Committee is scheduled to meet at a minimum on a quarterly basis formally. However, the department has direct access to the committee at all times to discuss any matters as needed and timely. So a primary component and responsibility of the Audit Committee and its role is to provide the board, yourselves, with oversight regarding the work being performed through both the internal and external audit programs. This reporting should be supported by the internal audit program, and best practice should include an open line of communication between the internal audit program, the Audit Committee, and the Board of Commissioners. So key topics of reporting should include at a minimum an overview of the audit program, its resources, which includes staffing, status of the audit work that's currently underway, results of the completed audit projects on the schedule, and discussion and overview of the status regarding process and control enhancements that are in flight as a result of the audit work that's been performed. In regards to the cadence of reporting, industry best practices include formal reporting at a minimum annually. However, the Audit Committee has direct access to the board to discuss any matters as needed. This direct open line of communication is a fundamental aspect of an effective reporting program, as it should be encouraged that information is shared timely and not only limited to a set reporting timeline. In summary, for today, the reporting process is a critical piece of both establishing and maintaining an effective audit program. Buncombe County has taken steps to ensure a transparent and efficient reporting process in line with both industry, best practice, and guidance. The key steps taken regarding the establishment and maintenance of the reporting program, to reiterate, include: 1, establishing and maintaining that the internal audit program and the staff included on the program are independent of functional operations, meaning internal audit does not oversee or execute business operations within the county. 2, establishing the Buncombe County Audit Committee, which is an independent oversight function tasked with overseeing the operation and results of the program. And 3, establishing a transparent line of audit reporting communication, starting with the internal audit program directly to the Audit Committee and to the Board of Commissioners. These are the critical pillars to ensuring a solid foundation supporting an effective audit reporting program. Thank you to the board for your time today to discuss this topic. And I look forward to working with all of you and the entire leadership team to provide the county with the best-in-class audit program. Thank you all. Any questions at this time?
Thank you, Dan.
I have a question. Good to see you again, Dan.
You as well, Al.
I want to understand now how, when we talk about the reporting, how do you interface with the county manager? Because, on a day-to-day basis, the way we do it now with the finance, the chief financial officer reports to us too. But he also has a dotted line to where on a day-to-day, he communicates with the county manager. Now, I know in auditing, look, from 40 years in banking, internal auditor would audit and control us, you might say. But You know, because when you look at the county commission and the audit committee, you know, I just want to know how that's going to work.
Yeah, so the key there is the position of the audit committee chair, Kendra. So we have a working relationship and an open line of communication. I think that's the best practice, is that that is really the outlet for kind of status review and understanding of where we're at on audit work, and that includes results and remediation. So just having that outlet to be able to communicate through that path in terms of that workflow. Now, from an administrative standpoint, obviously the relationship and the dotted line you speak to in terms of county management operations, I think that's beneficial in the sense that you're keeping abreast in terms of what is actually happening in operations and understanding kind of the heartbeat of the organization and understanding risks, right? So the key is really understanding what is happening currently, and that is formed through the relationship with management, including the county manager, but then also that key independent reporting line through the audit committee and ultimately to the board yourselves, is in terms of how we keep that independence and we make sure that we're keen on what we're saying, what we're doing, and where things are being reported.
Commissioners, other questions?
Well, so one of the reasons I was interested in talking about this, and thank you so much, Dan, for that thorough presentation, was for us to discuss how often we actually want that kind of report to the commission. Because in the past year, we just recently had a report, and it seems to me that we need to have it more than one time annually at this point. So that was the discussion. I was interested to hear how often, you know, whether that's quarterly or semi-annually, so that we have, I mean, I know there's a couple of commissioners on the internal audit committee, but in order for the entire commission to have a better idea of what's going on, I feel like we need to meet and hear from the internal audit committee more than once.
So my comments on that, so it's at the discretion of your appetite in terms of what you want. That's best practice. In my experience, historically, a board level, you at least get that annual discussion and report, which it sounds like you were getting, but it is ultimately at the appetite of what you feel fit in your position and what you want. I will say it's key that the audit committee is kind of the more day-to-day, overseer of kind of that process and the results and what's happening from a status standpoint and also reporting. So that's kind of why they're there in terms of giving that life beat. So that's really, my context, but at the end of the day, it's a decision that's made here by you folks in terms of what you want.
Thank you for that. I would think at least semi-annually. My sense from hearing from the internal audit committee was that they actually wanted to have better communication with the commissioners. So I feel that we do need to increase that beyond the once.
I would echo that and welcome that.
I agree. I see a lot of people kind of nodding their heads in agreement with that. So,
Yeah.
other questions? Or just while we're on that point, I mean, so once every 6 months, so twice a year would be one option. Does anybody want to kind of make an argument for a different, schedule than that? I mean, there's any number of ways it could be done, but that's, any other thoughts, or does people feel comfortable with that schedule for now in terms of, and that would be a meeting here in the commission chambers. I mean, that doesn't preclude additional, we've got 2 commissioners who serve on the board. We have had occasions where folks meet with members of the audit committee informally in between these meetings as well to just talk through issues and things like that. So, we could have additional opportunities informally as well. But does biannually feel like a good approach for now? Okay, well, it sounds like there's probably consensus on that for now, and we can always continue to revisit it if we want to go more frequently or different schedule. So, great suggestion. Any other questions or comments from commissioners at this time? All right, Dan, thank you so much. We're glad to have you on the team and look forward to working with you.
Excited to be here, and thank you for your time today.
Thank you. All right, the next item on the agenda is discussion of homelessness overview, and Jennifer Teague and Emily Ball are here to help us with this item. Thanks for being here.
good afternoon. Thank you for allowing us to be here today to talk to you a little bit about homelessness services in our community. I'm Jennifer Teague. I'm the Program Manager for Aging and Adult Services with Buncombe County Health and Human Services. Oh, did it not? I'm sorry.
No, you're fine. It's, where's the mouse? Everything's breaking. There, just push down to switch slides.
Did it go away? Okay. Okay, great. So this is just an overview slide about the things we're going to cover today. So our partnership with the City of Asheville and homelessness, our role here in Buncombe County, we'll do a little bit of an overview and the basics of homelessness, the role of the city, and then also the homelessness support system framework that we have here, as well as current planning and next steps. The first slide here is really about our partnership that we have with the City of Asheville, and many of you know about the Homelessness Initiative Advisory Committee. It's a jointly appointed committee, 8 members from the county commissioners and 8 members from the city council. That committee assists in funding or in making recommendations for funding regarding the COC, which we've talked about or we'll speak more about in the coming slides. It also oversees these funds and works with partnership organizations that provide homelessness services. We have traditionally served in a very traditional support role, and we also fund partially the staff member that is working at the City of Asheville to oversee HIAC. Buncombe County this is our funding stream that we currently are supporting in the homelessness work, and you'll see there that that's the $32,000 to support HIAC. $40,000 is currently supporting the Code Purple, and there will be another conversation later this afternoon around Code Purple. $50,526 is going into Homeward Bound for library outreach, and then $450,000 to Homeward Bound for case management and coordinated assessment, for a total of $572,526. And then we're going to turn it over to the City of Asheville to really speak more about the homelessness services framework, and Emily Ball is with us.
Thank you. Good afternoon. Glad to be with you all. I'm Emily Ball. I'm one of the 2 staff members at the City of Asheville working on homelessness in the Community and Economic Development Department. Just some foundational pieces here, some definitions around homelessness. So when I talk about homelessness, we're really specifically following HUD's definition of literal homelessness. So that's folks who lack a fixed, regular, and adequate nighttime residence. So that basically means people who are in emergency shelter, transitional housing, or places not meant for human habitation. So people who are outside, maybe in a car, an abandoned building, a place without utilities, a camper, or something like that. One of the subsets of folks who are literally homeless are people who are chronically homeless, and that's a population that we have talked about a lot. Those are folks who have really extensive service needs and tend to experience the longest periods of homelessness. They're people who have been literally homeless for at least 12 months, either consecutively or over a few episodes in a few years, and they have a disability. Skipping down, actually, another subset of that literally homeless population is people who are unsheltered or unhoused, and that's, again, folks in places not meant for human habitation, so people who are outside in cars and other structures like that. And then separate from the literal homelessness definition, there's an additional federal definition around homelessness that is the McKinney-Vento definition, and this is the definition that is used by the school system, so both Buncombe County schools and City of Asheville schools. This definition includes people who are literally homeless, but also includes people who might be doubled up. So school-age children who are doubled up with other people, staying on a couch, staying with a family member, and otherwise meet that definition. So a bit of a separate population, but those folks are identified through the school liaisons at both school systems. The point-in-time count, I'm sure you're all familiar with that. That just happened last week, and I'll talk about that in a bit. Point-in-time count is our best source of information about the homeless population in our community. So it is a one-night count, works just like a census. It's a demographic survey as well as some other questions, gathering information on people's homeless history and household characteristics, and is our only kind of comprehensive picture of the number of people who might be homeless on a single night in a year. This is a requirement from the Housing and Urban Development Department for every continuum of care. So in our community, the City of Asheville is the Continuum of Care lead, and we'll talk about that a bit more. The HUD requirement is that we conduct this count within the last 10 days of January every year. And so because we are doing the methodology the same way year after year, it gives us a good picture over time. So it's certainly not a comprehensive data set, but does show us good, accurate trends in the homeless population year after year. That count includes people who are sheltered, so folks who are in emergency shelter or transitional housing, as well as people who are unsheltered. We actually just conducted this count last week, so last Tuesday, and it will be a bit before we have that data back. We are still receiving those survey forms back from participating agencies. Process then is that I will manually enter all of that into our homeless management information system, and then we can also pull shelter data from that same system, run some reports that will deduplicate to ensure that we're not double counting anyone who may have thought that they would be outside that night but ended up going to a Code Purple site, for example, and then we'll have some preliminary data past that point. This is a snapshot of the point-in-time data from the last few years. So you can see our population overall has stayed relatively static. In the last 12 years or so, we've had more than 500 people, fewer than 600 people who've been homeless. Last year, our count was 527. What has changed substantially over that time is the composition of folks who are homeless. So the number of veterans, for example, or the number of people who are chronically homeless. Significant change for us last year was the number of people who were unsheltered compared to the prior year. City of Asheville, our role relevant to homelessness is that we, of course, staff the Homeless Initiative Advisory Committee. We also serve as the lead entity for the Continuum of Care. So Continuum of Care is a HUD framework where we're looking at a specific geography, and within that geography, working to end homelessness. So working to identify who is homeless in that area, what's the right mix of interventions, how do we continually get closer to zero by decreasing the number of people becoming homeless and increasing the number of people exiting homelessness. We also oversee federal and state funds and contracts with service providers. And through our office facilitates access to 2 pots of HUD funding that are specific to homeless programs. Those are the Continuum of Care and Emergency Solutions Grant funding. And then we also provide some direct city funding for those staff positions, for Code Purple, and for outreach and coordinated entry at Homeward Bound. The Continuum of Care, as I just said, is a HUD-defined geography within which there is a lead entity. So the City of Asheville is that lead entity in our community. Our role in that is really to look at homelessness as a closed system. So want to measure inflow and outflow, so how many people are becoming homeless, how many people are exiting homelessness, how long are people homeless, so what's the efficacy of our service system, and how do we continually improve that. We want to analyze that for duplications and gaps, and really be very specific about the need of the homeless population in our community within that geography. Using all of that information, all of that data to develop and implement a strategy, again, to get closer and closer to zero. So the City of Asheville serves as the lead entity for our Continuum of Care, and in that we do all that stuff that I was just talking about. So we coordinate and support the homeless service system across our community. We facilitate annual reporting, including the point-in-time count, and report that to the federal government. We collect and evaluate data, so we manage that database, the Homeless Management Information System, and we serve as the collaborative applicant for annual funding applications. Our goal as a Continuum of Care, and certainly our goal at the City of Asheville, is permanent housing. So our goal is to continually decrease the number of people who are experiencing homelessness by moving people into permanent housing, supporting them so that they stay housed and don't become homeless again. And part of our process in that is really to look at functional zero, which means we know that people will always become homeless in our community. Folks will experience housing crises in perpetuity. The goal is that we have a really high-functioning system so that when that crisis occurs, we can respond quickly and effectively so that people are homeless for fewer than 90 days. That is not where we are as a community right now, but that is the goal that we want to be always working towards. This is a very both complex and basic overview of the homeless service system in our community. So on the front end, we want to be preventing homelessness as much as possible. So anyone who has gotten behind on their rent, for example, want to keep them in that apartment where possible. Once people become homeless, we want to be conducting good outreach, getting people connected with services, providing emergency shelter where that's appropriate, or transitional housing. And then again, always working towards a permanent housing goal for every single person who's homeless through either rapid rehousing or permanent supportive housing, or where possible, diversion. So if you look at that top left section of the graphic, diversion is essentially problem solving for folks when they first become homeless. So how can we help you reconnect with a family member, for example, or get back home if you're stranded here from another community, so that people don't then need to enter that homeless service system. This is an overview of the capacity of our service system, and I won't get in the weeds of this, but this is kind of a basic picture of the number of emergency shelter beds and the number of transitional housing beds that are available. I will say that these numbers can flex some. So Salvation Army, for example, has 30 beds. Depending on the household composition, they may end up serving 32 people if they have a parent with children, for example. But overall, we have around 179 emergency shelter beds and 256 transitional housing beds. Coordinated entry is the system that we follow. This is a HUD-required system for every continuum of care to identify who receives what type of housing program. So the idea is that it should not be dependent on the person in crisis to identify the right resource to resolve their crisis, but we should have a no wrong door approach to system entry, so that all of our people who are in need of assistance are kind of pooled and all of our housing resources are pooled. And then we use the structure to make an appropriate match so that the person gets the need, that gets the intervention that will meet their need to resolve their experience of homelessness. And within that process, folks are prioritized by the acuity of their needs. So the goal, very morbidity oriented, very, very much based on who is most likely to die if they continue to be homeless. That's the person that we need to prioritize for the next intervention. There are two different types of housing interventions, rapid rehousing and permanent supportive housing. Both of these are typically housing first approaches, where people are offered housing and then provided support to access that housing. Rapid rehousing is a time-limited program up to 2 years, ideally, and providing rental assistance as well as case management. Best practice, again, housing first, so no preconditions for entry. And the benefits of rapid rehousing are that it's really upstream intervention for lower needs people. So folks who may have had a good work history, have had some kind of crisis, have lost their housing, don't actually need all that much support in order to stabilize again and remain stable. Rapid rehousing is the best intervention for them. And you can see we have 3 providers in our community for rapid rehousing. Those are Elida, Helpmate, and Homeward Bound. The other housing intervention is permanent supportive housing, and I imagine you may have more familiarity with this. Permanent supportive housing is also providing rental assistance, also providing case management, but specifically targeting people who are chronically homeless and who will need that support long-term in order to not return to homelessness. This can be site-based, so in a single building, or scattered sites, so working with private landlords out in the community. But the structure is that the occupant has a legal lease in their name and they must comply with the lease terms. Again, best practice is housing first. And providers in our community of permanent supportive housing are Homeward Bound, and this includes the Days End project that will be coming soon. Step Up will be a new provider in our community, operating at the Ramada to create additional permanent supportive housing. And then HUD VASH is operated by the VA Medical Center specifically for veterans. I'll turn it to Jen.
So I wanted to make sure to take an opportunity to speak a little bit about the current planning and kind of the next steps. So one is the expanding the support for Code Purple, which again will be on the agenda for a later discussion. However, there is a lot of conversation happening in the community around additional support, both financially and need. Also, as I talked about at the very beginning, currently HIAC, which is appointed 8 members from this board and 8 members from the city council. The city of Asheville is actually making some recommendations regarding the restructure of HIAC, and the staff is currently working on those recommendations, and the county's waiting on what that final document will look like, or final draft from the city will look like. Essentially, they are asking for a change name from HIAC to NC 501 Asheville Buncombe Continuum of Care Homelessness Initiative, mouthful. And it'll be 2 distinct bodies. So it'll be formally designating the Continuum of Care Governance Board, which we do not currently have formally designated, and that's something that they'd like to see, and then a general membership body, which would change slightly the structure in which right now you appoint 8, the city appoints 8. Their recommendation, which still is in conversation, is a 3 appointment from this board, 3 appointment from the city, and then a general membership body that's elected from those members that will be on the newly named Continuum of Care Board. And then finally is a comprehensive homelessness study in which we have staff from both the county, staff from the city, and staff from Dogwood Health Trust that's meeting to discuss and determine what are the best needs in our community. And there is conversation around the need to hire a consultant. And these 3 entities are meeting to talk about what an RFP will look like, what that consultant will do, and the next steps related to those determinations. That's all that we have, and so open up to any questions.
Thank you all. This is, excuse me, incredibly helpful. I have a couple of questions. One thing that I have heard many people say at the community level is that in addition to the need for the rapid rehousing and the permanent supportive housing, and those are critical strategies, there are also folks who may not be ready to take the step into permanent supportive housing for a range of reasons. And it feels like that's a piece of the policy strategy and funding questions in front of us as we think about how we move forward into creating a high access shelter, and also how we think about what it means to best serve kind of the range of people who are unhoused or unsheltered, is understanding that's not always going to be a quick process for someone to get from being unsheltered to being ready for permanent supportive housing, which would seem to be the first step in this continuum in a lot of cases. And it feels like that's also the place where a lot of the most complex intersecting needs around mental health issues and addiction play out, at least for some people, that might make it challenging to take that step into permanent supportive housing. Or they might elect that as an individual, that's not actually the outcome they want, right? They might prefer living in a different, or being in a different setting. So I think I'm very excited about the planning process we're moving forward with Dogwood, city and county all at the same table, having the conversation around high access shelter. And I also think there's an opportunity, maybe need to sort of punch out this other description, basically, of what kind of programming and services can be provided for folks, where it might be a longer period than 90 days, for instance, or it might be 3 years. And success for some folks might mean that they have access to regular medical care and are stabilized on medications they need to be on, and are taking some early steps around addiction treatment that they're ready for. So I just feel I'm excited about, as we move forward, trying to enumerate with the same degree of specificity in that area that we have been able to, I think, around the continuum of care into housing, if that makes sense. So that ended up being more of a monologue than intended. I wonder if you all have any feedback or thoughts around that, and sort of what you're seeing in terms of best practices, either here or in other parts of the country. This is by no means a challenge that's showing up only in Asheville and Buncombe County. It's showing up everywhere. And I think a lot of people are wrestling with sort of the best programs to invest in and support around that.
Yes, so thank you for saying that. And I'll first say that a couple comments. One, the City County Dogwood Health Trust conversation is truly about looking at the whole picture, and we're trying to consider the high access shelter as one of a potential intervention. And that is something that is specifically earmarked in the RFP, is asking the consultant to also have interviews with individuals with lived experiences, talking to individuals about what needs currently exist in our community, where they're not able to get their needs met. So we hope that we'll be able to address many of the things that you've just highlighted and the importance, because one intervention may not be the best intervention for everyone. And so really taking a more comprehensive approach in the RFP around how to meet the needs of many in our community and not just one path forward. I'll also say that staff are also and have been looking at what other communities are doing. County staff have been looking at what other communities are doing, and I think that's been a good opportunity too, to learn from other counties about how they are addressing homelessness in their community and how their both county and cities are working together to meet these needs. I don't know if Emily has any additional comment to make.
I'll just tell you my own experience about that. I think it's a really excellent point, and you're identifying a population that has some unmet need in our community. My experience is that everyone is ready for housing, and most everyone does want housing, and that is what Housing First is all about, right? So let's bring people in, no preconditions, regardless of requirements, in order to get them stable and in order to meet their needs. What I think happens is two things. One, there's a very long gap between the need for permanent supportive housing and the ability to access that permanent supportive housing. So even right now, with the Days In and the Ramada projects coming online, that's going to add 185 units of permanent supportive housing, which is incredible. It's the biggest infusion that we've ever had at a single time in our community, and it's probably a year away from occupancy for any of those units. And so in the meantime, we need a place for people to go. We need appropriate services and a response for that population that's waiting. I also would say that this is where diversion comes in. So a lot of people who we might think need permanent supportive housing actually could be routed to a different resource that is a better fit for their needs. And this is an experience I'm having present day at the Ramada as we're working on exit options for folks there. So there are 6 people right now who have reconnected with friends and family and been able to go back home. And those are folks who otherwise would need permanent supportive housing in our community. So I think really the idea is kind of a triage approach. How do we really dig in with this particular individual and figure out what will resolve their specific crisis?
That's one way I've been hearing some folks talk about the high access shelter concept is sort of like an emergency department around homelessness that's open 24/7, anyone can go to and then get the kind of assessment and referrals that we need, that they might need or be ready for. And some will be ready for those steps that very day. Others, it might take a little bit longer. But I think having that consistency day in, day out, 24/7, where there is that sort of ability to tether into all the referrals and services is an exciting step forward to think about in our community. So appreciate the back and forth here.
Thank you both. Yeah, Emily, I just have a question about some of the data there. Can you speak some to the increase in unsheltered and what you're seeing with that and what you think is contributing to that specifically?
Yes, although I'll give you the immediate caveat that I can only tell you my own opinion around that. I think certainly COVID is a significant contributor, and I think we see that in a number of ways. One is that shelters have changed their shelters. Because of COVID protocol, because of the need to move beds further apart, for example, or to dedicate quarantine space for new folks who are coming into that shelter, all of that has really changed the inflow. Some shelters have requirements around a vaccine or a negative COVID test. It can be really hard for people to meet those requirements when they're in crisis. So part of it is just shelter capacity, I think. I also think COVID has been very difficult for all of us, of course, and so that has shown up for a lot of people in mental health and substance use. And the more complicated those behaviors are, the less people have the ability to access shelters or to stay in shelters. So shelters often have a lot of requirements around being clean and sober, for example, or being engaged in treatment, something like that. And a lot of folks are not currently in a position to do that. And then I also think that we have had, and again, I can't substantiate this with data, but I think that we have had a number of people who have been just right on the edge for a long time. You know, folks who have been just barely getting by, who have had kind of thin support systems. And as we have all been in crisis in response to COVID, I think a lot of those support systems have burned out. And so we've had an infusion there. I don't think, you know, at the beginning, I think we all thought that we would have a lot of job loss and that would lead directly to homelessness. And I do think we have some of that, but we've had a lot of assistance programs in place across the country. And the path to, I lost my job to now I live outside is a long path for most people. Most people would, you know, again, you connect with friends or family or access other supports. So I think COVID is a big part of the story, but in kind of some nuanced ways. And then the other thing I would say is that we are hit hard by the opioid epidemic in our community, and that's a very direct pathway into unsheltered homelessness in particular.
Great. Jen and Emily, thank you both for being here today. Really appreciate it. Thanks for all your great work on this important issue. And I would just also say that, you know, the Affordable Housing Subcommittee is dedicating more time to this. We've been talking about development of goals around construction of new affordable housing. We're going to talk about that a little bit later today. But over the last couple of meetings and in our coming meetings, we're also sort of taking a deeper dive around the homelessness issues. And our expectation is to subsequently bring forward some other goals for the Commission to consider specifically around homelessness concerns. So anyway, thank you all for your help with all of that and your great work in the community on this important issue. Okay. Next up, Rafael Baptista is going to talk to us about the community survey results.
Good afternoon, Commissioners. Depending on how you look at it, I have good news for you in that I will not be the one doing the presentation, but rather our vendor who did the survey will be doing the presentation. So we have Ryan Murray, who is the Assistant Director of Community Research for ETC Institute, who did this survey for us. We'll be walking through the survey results with you. And Ryan, just let me know when you're ready for the next slide.
Yeah, I'm ready. Am I sharing my screen or are we going to go through your screen?
You're going to share through my screen.
Okay, great. Well, I'll go ahead and turn off my screen share then. I apologize. And, let's see here. All right. So yeah, Raphael, if we could go ahead and just go to that screen with the map on it. It'll be the second slide in the presentation. All right. So thank you, Commissioners, for having us here today. It's been a pleasure. First of all, I'd like to just say it's been a pleasure working with Raphael and Matthew Baker from their department. It's just been a couple great guys to work with, and I just can't say enough about how easy they made the process and then how well I felt like they handled kind of taking the survey to everyone throughout the organization to make sure we could try to build some consensus with the results. One thing to know before we get going is that ETC Institute is really the national leader in market research for local government organizations. And we've got more than 1,000 city clients in 49 states and over 3 million people surveyed in just the last few years here. And really our main mission and our goal here at ETC is to help organizations make better decisions. And we do that through this type of research work. So go on to our next slide, our agenda slide here. Today, we'll just go through the purpose and methodology. We'll touch on a couple of things to know, major findings, we'll summarize, and then I'll take any questions. So we'll go to our next slide 4. The purpose of this survey, in many of our surveys that we administer across the country, is really an objective assessment of resident satisfaction with the delivery of your services. Beyond that, the survey was designed in a way to determine priorities for the county. So even if you would have had astounding satisfaction for every single service that was rated on the survey, or strong levels of agreement for every statement that we asked folks to rate their level of agreement with, we still would have helped determine some priorities based on some of those results. So I just want everybody to kind of know the intent of the project. Beyond that, we're able to compare your performance with other communities regionally and nationally to help put things into perspective for you just a little bit. Move on to our next slide, which is methodology. It was a 7-page survey. It was the first survey conducted for the county by ETC Institute, although we're familiar with the area and the state in general. First survey conducted for Buncombe County. We administered that survey by mail-in online to a random sample of households within the county, and each survey took about 15 or 20 minutes to complete. As we were completing those surveys, we were tracking both demographics and geography to make sure we had a good representation on both for folks throughout the county. Go to our next slide and talk a little bit about sampling size and goals. We had a goal of 500 completed surveys, but folks really showed up for the survey. We got 753 completed responses. And really what that helps us do is lend a little bit more reliability to the aggregate survey results. So we have a confidence interval and a margin of error for the results. We've measured this starting at the 95% level of confidence to come up with a margin of error of about 3.5% at that 95% level of confidence. Which means that if we were to conduct the same survey administered to 753 people at random, we would 95 out of 100 times get these same results, plus or minus our margin of error of about 3.5%. So we set the goal at 500 as kind of based on your population size of the county. We could have gone a little bit smaller. We could have obviously gone larger. But really the item for ETC Institute that's most important is maximizing your investment in our services. So I'm never going to propose, 2,500 surveys to a community that could have reliable results at the 95% level of confidence and a margin of error of about 3%, if that'll get us the results that we're looking for. And just kind of keeping in mind, this is our baseline survey where we'll be kind of looking back from past results, that this will be kind of the beginning of that results trend. And so I just want everybody to understand we don't know what we don't know before we asked it. And so some of these results I think should be framed in the context of this was our first survey experience and recent, for most of you at least. And so I just want to kind of make sure that we're all kind of moving forward with that perception. And with that, we'll get into our perception slide. And Raphael, you can just go ahead and skip right along to slide 8, perceptions of Buncombe County slide with the chart and graph there. So I've highlighted a couple of items on the chart down towards the bottom. These items received the largest levels of below average and poor responses from folks as a place where you can earn a living wage and as a place where you can find affordable housing. And these are really county priorities that residents indicated should receive the most emphasis. And they also received the lowest ratings. However, some of the grade card items, as a place to visit, play, live, retire, all received some of our highest levels of excellent good ratings. And those are the areas that I'll tend to focus on first. And we'll have some national and regional comparisons to some of these items as well. So kind of a mixed bag toward the bottom of some of those below average and poor ratings. But overall, we got some pretty good ratings when it comes to general perceptions of the county. We'll talk about some of those as we kind of get into our analysis a little bit later on. When we switch to our next slide, question 6, we asked respondents basically to place a level of importance on each one of the items listed to the left of this chart. What this chart is telling us is the level of emphasis respondents think the county leader should place on the future county priorities over the next couple of years. So this is kind of a follow-up question to an agreement question or an importance question that we ask respondents. And the priorities that were most important to residents in rating their importance on a 5-point scale weren't the same priorities as they want you to emphasize. And so some of the areas that they want you to emphasize go right along the lines with our previous chart in the areas that received the largest below average or poor ratings. And that's providing equitable access to housing, living wages, addressing homelessness, and then kind of a surprise one towards the top here, addressing gun violence, and then providing equitable access to mental health care or quality health care, kind of rounding out that 30% above of respondents who indicated this is one of their 4 top choices that they would like the county to emphasize over the next couple of years. And so in your full report, you'll kind of see the juxtaposition of question 5 and question 6 in those ratings, but this is really the more meaningful table, considering that some of the importance of those items kind of waned when folks were actually asked to compare which 4 of this giant list or this large list they think should receive the most emphasis moving forward. When we go to our next slide, we'll talk about general levels of satisfaction with the core county services provided. Only one item stands out here really in terms of dissatisfaction, and that's quality of county development, planning, and zoning, which is just a difficult item because we know that most residents in most of our counties nationwide don't have a really good handler. They don't have their thumb on the quality of county development, planning, and zoning, but folks do have a perception that's been made of some of those choices. And so one of the items we always suggest to clients is more robust communication and engagement with the community when the county's about ready to make a development, planning, or zoning decision to ensure that the community is well informed with what's going on. They may not agree with your decision or your actions, but at least they've been informed as to what they are, and they tend to be a little bit more kind in our satisfaction ratings when they at least have a really good understanding or are brought into the process, which is a really difficult thing to kind of engage folks in some of those development, planning, and zoning processes, whereas we know that they're invited to those public meetings now, but not usually signing up at robust rates. If we go to our next slide, it'll show the responses for question 4. And while the county equitably provides services, residents disagreed with other statements at relatively high levels. And so some of these statements are definitely perception statements about the county. Folks generally believe they have equitable access to your services, regardless of their race, ethnicity, or any of those particular items. But when it comes to the county being trustworthy or caring community in harmony with its environment, or some of those other items towards the bottom there's a large group of neutral ratings, which tells us that folks really haven't had a positive or negative impression made on them from that particular stance. But about 35% or so gave our disagree or strongly disagree to those particular statements. So we just want to make sure we're kind of tracking that and maybe even encouraging or engaging folks in particular ways that kind of hit at a few of those bottom items in order to boost the agreement level with some of those statements. We'll go forward 2 slides this time, Raphael, to our benchmarks tables. We'll have regional and national comparisons in your report. We'll have a full list of an appendix with these tables. I just wanted to highlight some of the areas here, as you can see on the screen, as a place to visit rated phenomenally or significantly above our national and regional averages there. But we're more aligned with, or maybe even below, as we look at a couple of these bottom items as a place to work, or the overall image or reputation of the county government, below significantly some of those national and regional averages. But these regional averages and national averages are really just meant to help put into perspective some of your results. At first glance, you might have thought that 65.6% as a positive rating as a place to live might have been of a major concern. But what you can see is that you're actually quite in alignment with our regional averages, and just barely kind of a significant change above and beyond our margin of error compared to our regional and national averages there. When we go to our next slide, we'll see comparative advantages to the national average and the Atlantic regional averages. And what we really see is the county is a place to live, or excuse me, is a place to visit. But beyond that, your recreation and library services, for the most part, are where you really tend to excel above our national and regional averages. And when we go to our comparative weaknesses, our next slide, we see some of those items that we saw towards the bottom of that benchmarking table that I showed you just a moment ago. So overall image or reputation, efforts to be open and transparent, and that's where I was kind of touching on that previously when it comes to our planning, zoning, and development issues. Just making sure that folks have ample opportunities to participate and are trying to be engaged with at various levels to ensure that they're kind of brought into decision making. And what we see is that the national and regional average weaknesses are pretty much aligned with one another beyond that timeliness of information provided by the county over there in the Atlantic regional column. So we'll skip forward again 2 slides, Raphael. One of the things that I said at the top of the presentation was that the purpose of this project was to develop priorities one of the slides that I hit on towards the top of the presentation as well was kind of an emphasis slide. What do you think we should emphasize? And what we know is that folks tend to overstate the importance of items, which would have been that question number 5, or sometimes they even overstate their satisfaction or dissatisfaction with a particular service that maybe they don't have a really good understanding of. And so in order to help prioritize for government organizations, it's important to understand which one of those services received lower levels of satisfaction, but most importantly, which services are most important to you. So if we've got a service that is lower than average satisfaction, but it's not overly important to residents, then it's not going to move our needle in terms of serving residents at a higher capacity. What we need to focus on is not only the satisfaction placed, but here in this table, the emphasis that residents believe should be placed on that item. And we can see far and away county development planning and zoning, top item, but we also see county social services and public health services kind of rounding out the top 3 items that they think you should emphasize over the next couple of years. By combining these 2 analysis types, Raphael, we can switch to our next slide. We develop our important satisfaction analysis, which is seen in a little bit different format in your report, but still the same exact information. I just like to provide kind of a higher level of analysis for you all in these presentations. And so I've highlighted with various color schemes here to kind of give you an idea of the levels of emphasis that I believe professionally placed on some of these items. And as you can see, county development planning and zoning is at the top of this list. While something where you might not even make a lot of decisions on those particular topics throughout the year, there's something going on in the community that is causing folks to have significantly below levels of satisfaction with that item, and they believe that it is extremely important for you all to emphasize that moving forward. Now, what that means is a little bit more difficult to say, but again, communication and engagement with residents in those terms of development planning and zoning can go a long way of just helping educate some of the problem that might be there. When it comes to Buncombe County Social and Health Services, we see those items as also top priorities, but to a much lesser extent, as you see in that far right column. Satisfaction rating is significantly higher for the development planning and zoning item. Anything in green in these lists are items where you've performed relatively well to the other items in terms of satisfaction, and they're below average importance. And that really means that even stark increases in satisfaction with your county library services, which is one of the highest rated services on the survey, even stark increases in service levels from the library folks is not going to move the needle in terms of overall satisfaction with the delivery of county services. And so focusing on the items at the top of this list is going to give the county the best opportunity to begin to make an impact in some of these items across the board. And so I just want folks to understand that's where we like our clients to help focus on. And we've got a lot of history of clients kind of using this analysis to help propel themselves forward and boost general satisfaction ratings in the future. So we move to our next slide. We also conducted the same analysis for communication. There was a number of items that were ranked in that particular category. What we found is the level of public involvement in county decision-making is one of our areas of importance, along with county efforts to be open, transparent with information. Those are really our top 2 priorities, followed by the effectiveness of county communication and the availability of information about Buncombe County services and activities. So really it is more of an engagement issue. We're likely providing a lot of this information, but we need to determine where those folks would most like to receive or how they would most like to receive some of this information. And we'll see a cascading effect if we're able to combat some of the communication issues that we're seeing in the important satisfaction here. We'll see increased satisfaction really across the board, I believe, in a number of your core service categories if we're able to tackle some of these items. Most residents believe that the timeliness of information is just fine, the quality of social media outlets is just fine, and really it's about public involvement, engagement, and making sure that you're transparent with some of those decision-making items. We move to our next one. It's Parks and Recreation. This was one of the other items that received really top marks and was one of your comparative advantages, both to our national and regional averages. Folks would like to see probably an increase in the availability of open space, natural areas, and green ways in the county, some maintenance of county parks, additional maintenance, the availability of park amenities for residents, regardless of their age or ability. If we're not careful, we will see the quality of open space, natural areas, and greenways in the county begin to creep its way up into the high or are very important high priority categories, those red color schemes. But for the most part, that one's doing pretty well too and had relatively high levels of satisfaction. It was just more than 1 out of 5 respondents selected it as one of the most important items to emphasize over the next couple of years. So we've done a very good job in terms of Parks and Recreation, and considering this is a baseline survey, I think the analysis highlights a number of low-hanging fruit items that we can begin to tackle, really focusing in our communications division to help get the ball rolling with engagement and communication with folks that will then cascade satisfaction throughout a number of different areas throughout the community. If we go ahead and flip forward 2 slides again, Raphael, the county is really the primary source for folks, but local TV news is a close second in the community. And so what we did is we asked residents to rate their level of satisfaction with various county communication services. This was already kind of detailed in our important satisfaction analysis, but I thought it was important to highlight some of these items again. And the areas highlighted with red arrows are those items that were determined to be a high priority based on our important satisfaction analysis. One thing to note is the quality of BCTV County's cable television channel was towards the bottom in terms of general satisfaction, with the sum of very satisfied and satisfied responses. But a vast majority of folks were in the neutral category. It received very low dissatisfied and very dissatisfied responses, and it's just not the most important source for communication for most folks, which is why it may be at the bottom of this list here, but it was not a top priority for improvement moving forward. Really, the level of public involvement in county decision making was the top item there. If we move to question 10, we asked residents to indicate which sources of information they use to learn about county events, news, events, and other information. I did see friends and family relatively high. We have, over half of our residents indicating from word of mouth, but less than 1 out of 5 respondents preferred that method, as we'll see in our next upcoming slide. But what I found a little bit the number of respondents who rely primarily on the local TV news to get their information. It's difficult to engage with local TV news, and so making sure that we're focusing on some of those communication methods that maybe even aren't listed here, where it can be a back and forth with residents. Folks were generally satisfied with your social media outlets, so making sure that we're promoting those and keeping good track of what's going on there, and making sure that there's feedback loops there so residents can respond to our stuff, and then we're responsive back to them with the pertinent information is going to be really important. When we look at our next slide, we'll see the preference for information sources used to learn about Buncombe County. We see a very similar delineation of some of these items here, but we see county text alerts kind of raise the list here and actually jump social media in this particular list. So folks, while dependent on your website, they're telling us that they do prefer that. We are missing a few areas of engagement, and some of the gaps or the important satisfaction analysis items from communication would suggest we should be investing more in engagement, maybe more into our website or functions of our website that promote engagement and community outreach. And so it'll be really important to help plan and prioritize some of our communication efforts moving forward to help combat some of the perception-based issues that we saw in the survey. It's pretty realistic to assume that you're not making poor planning, zoning, and development decisions, but it's just the fact that residents weren't aware of them is what's causing some of this dissatisfaction throughout the survey. If we move on to our next slide, slide 25 in total, this is the types of information respondents would like to see more using their most preferred sources of information. Folks are really concerned with crime data, budget information, and priorities, and some of that information can be difficult to find online, even if it is on there. Sometimes it does take some digging. And then rounding out the top 3 was land planning and development issues. So again, kind of going back to some of our top priorities for improvement there, folks would just like a little bit more information about that. So using all of those different various data points throughout the survey to help kind of surmise that we need to be more active in our engagement, and really putting this information in front of folks is going to be important. Well, one thing that I also wanted to hit on before we get to some of our unique questions, Raphael, if we could go forward 2 slides. This should be our question 20A, level of satisfaction with customer service provided by Buncombe County employees. I just wanted to let everybody know that being a front-facing public servant employee, like working at a county or city government, is really difficult. Folks might call you about city roads and expect your employees to help them determine next steps in fixing a city road, or they might have code or ordinance issues within the municipality that the greater county wouldn't handle. And so a lot of those folks' hands are tied with either red tape or the inability to assist those customers or those residents to fulfillment. And so it's a difficult proposition. But what you should be very proud of is the extremely high levels of satisfaction with all of these items on this list. So anybody that had contacted an employee within the past year were asked to rate these questions, extremely high levels of satisfaction throughout. So all of those folks that are forward-facing or front-facing employees should really get a good pat on the back for all of the hard work that it takes to kind of sustain or at least receive initially in your benchmark survey the ratings that we see here in this slide. If we go forward 2 slides again, Raphael, these are some additional questions that we asked on the survey. I just wanted to make sure that I thought these were important, not only based on conversations with Raphael and Matthew, but based on some of our priorities for improvement. And what we see is feeling of safety. Folks are interested in crime data. There was a couple emphasized issues of gun violence or homelessness. And so I wanted to highlight that most folks in the county are feeling pretty safe in most of these situations. And as you can see, the sum of very safe and safe responses out there to the left in blue, very few neutral responses, and only some folks kind of giving us that unsafe or very unsafe rating in any of these particular items. But overall feeling of safety in the county, significantly above half, which is where we want to see it in most communities. If we go to the next slide, we'll see level of satisfaction with solid waste services. I know this is kind of a hot topic in the community, but we had about 60% of our respondents indicate they received solid waste services from Waste Pro. They received pretty good markings in the top 2 items, overall Waste Pro trash services, recycling services, and where they were hit, and where we'll see most trash haulers get hit is the bulky item pickup service, which is likely folks weren't necessarily following all of the bulky item rules. And so they were either kind of neutral because they hadn't used it or dissatisfied because something maybe wasn't picked up in one of their last attempts. So that's typically the reason. And I'm actually administering a small survey on bulky item pickup specifically in a community right now. If we go to our next survey, we'll see there was a unique question that we included. We asked folks if there was a mobile app that would notify them of Waste Pro pickup schedule changes, would they use it? We had about 56% of folks say, yes, I would use it. That's a pretty good majority. About a quarter said no, and about 15 or 16% skipped that question. And that was out of the 59% of folks that said they'd receive their services from Waste Pro. So while majority would like to see that, it'd probably take some greater outreach and communication with community folks who do receive those services, just to make sure that is kind of the aggregate opinion of all those Waste Pro service customers. And in one of our final table slides or chart slides, we also asked residents if the county were to consider offering waste convenience sites, how supportive they'd be of that decision if fees were added to their property tax bill. What I think we were hoping for is some kind of clear delineation or kind of a decision-making response to this for us. Unfortunately, things really split evenly across all response types. So the neutral and don't know response types are pretty equal in and of themselves. But beyond that, we've got splits for the very supportive responses in blue and the not at all and not supportive responses in red. This is likely an indication that we maybe needed to tell folks how much of an increase. If we were looking at 25 cents or $1 increase, we might have been able to get a better understanding of where folks were going to lean. But without that information, it's difficult to kind of take that to the public in a question. A lot of folks would assume that that's what the fee increase would be. But we must also understand that only about 60% of our respondents received Waste Pro services. Most folks were asked to fill out this question. So not a lot of folks have the need for this type of service, and probably looking more at some of our rural residents would be the place where we'd see higher levels of support. But in aggregate, the county residents as a whole, not supportive, not supportive of this particular item. Everybody just kind of falling into that middle ground there with just about 40% or 35% on either side of the aisle. In summary, we can go to our next slide. Residents of Buncombe County truly believe that you've got a great place to visit. And I think that maybe some of the marketing of the county, or maybe some of your municipalities in the county, are impacting some of that because they gave lower ratings as a place to retire racial children at work. And I think that is a little bit interesting given some of the other ratings that we saw and throughout the survey, but definitely something that really robust new communication types can help us kind of put into place. And all that takes is simple feel-good stories throughout the year, making sure we're engaging folks in those places where they like to be most. We know that they like to go to our website for information, but we should try to do our best to make sure that information is where they are versus making them kind of come to us for that information. And if we are able to grow our following or grow our engagement, we'll be able to put those positive stories in more of a positive light throughout the county for all residents. And I think that's really important to combating some of the lower ratings that we saw in some of those perception items. I think it cannot go understated that employees provide excellent customer service to your residents. That chart was phenomenal. Those are extremely good ratings, and that's a difficult position to be in. County core services received mixed reviews, but hopefully the important satisfaction analysis and the full report helps to contextualize some of that along with the benchmarks. But it should lend itself to kind of a road guide or a roadmap of how we can combat some of the items that are at the top of our important satisfaction lists to ensure that it cascades and general levels of perception and satisfaction begin to increase throughout all areas of our services. And communication and public engagement should be a top focus over the next 5 years, and residents told us as much, but it will go a long way in helping to combat some of those negative perceptions that we have where we know residents aren't in those planning meetings. They're not necessarily watching some of our recorded or live public meetings. And so without that information, they're really getting that information from local TV, word of mouth, and some of those other sources that are not curated or mandated by the county. And so making sure we are there to provide the correct information is going to be really important over the next 5 years or until you do your next survey. And with that, Raphael, we can go to our last slide and I'll take any questions.
I got a couple questions. Could you, I guess, define what is meant by Atlantic average? What's that region describing?
Yeah, it's in the full report. I don't have it off the top of my head, but it's like North Carolina. I'm sorry, I can pull up the report here. It's a number of those states right surrounding North Carolina. And so it's North Carolina, maybe South Carolina, Maryland. I think Delaware is included in the average. And I apologize that I didn't have that right in front of me here.
I just bring it up. What stood out to me perhaps most about this was how 75% of people within this region have a positive image of their county, but only 32% of residents of our county do. That's just an astonishing difference to me.
Yeah. I do think that probably has to go along the lines of some of that communication and the most used communication. You know, the website is there and it's static. We can go to it to find what we need. We know it's going to be truthful, but a lot of folks relied on local TV news. And so unfortunately, you know, the local TV news it's not in their best interest to push out the positive stories. They're kind of looking for viewership and selling commercials. And I think, unfortunately, those two things aren't aligned. So making sure that we become kind of that source for folks and are pushing out those things that we know are happening that are great in the community is going to be really important to make sure that we kind of begin to sway folks into that positive category. Because if it's a great place to visit, I can't imagine it's not a fantastic place to live as well.
Yeah, that makes sense.
Can I just ask one clarification while we're on this point, though? But because I may not have got this correctly. These are all Buncombe County residents answering the questions, right? So it's Buncombe County residents saying, oh yeah, I think Buncombe County is a great place to visit, but who are then, those same people are saying, but as a place to live full time, it's not as great. So it's not the outsiders saying, oh, I love going to Buncombe County. It's people who live here saying, I think we offer a great visitor experience, but it's a tougher place to live full time.
Yes.
Okay, just want to make sure I was the same people. Go ahead, Parker.
No, thank you. And then my other question, I'm trying to drill down on the question or the phrase quality of county development planning and zoning. That's something you used on a lot of our slides. It's I guess our biggest problem area according to this data. I'm wondering if either now or later you could share with us, I guess, the question or questions that led the participants to create that data. Because in my mind, there's a difference between, zoning regulation, land use outcomes, and people's everyday experience with like the built environment and what they see when they drive down the road and where they live. Those are all three different things, and you can slice it further than that. So I'm just trying to drill that down in my mind.
Yeah, so what you saw in the presentation files was verbatim from the survey instrument and just asking generally to rate your satisfaction with that particular item. It gets hit in a lot of communities as one of those tough items. And I think you hit the nail on the head towards the end of your comment there, where we know that the multifamily dwelling was built too close to our home, but we don't understand what went into that decision-making process. And most importantly, we know truthfully and honestly deep down, we weren't involved in that process, either by choice or, some folks are busy and they just can't attend these meetings and be active participants. But that's where communication and engagement comes in, is we need to be engaging these folks in these types of discussions more and trying to really pull them in by their neck collars into these meeting rooms. Because without that information, you just see the 3-story multifamily dwelling go up, but you don't have any context as for why. And so that's why I harp on communication and outreach, is because it's difficult to get those folks into the meeting. So we really have to put the information right in front of their faces, or they're not going to go to our website to search for it, where it's all publicly available. So I think that was a really great comment. We know when the built environment is changing, not to our liking, but we don't have a really good understanding of what goes into that. And that's likely the issue with that particular item.
And if I could add, Commissioner Sloan, as part of the comprehensive plan, as part of the current window of community engagement, that's one of the things that the planning department's really going to be diving into with residents is, what are you looking for? What do you want to see improvements around in that general zone? So I would say for this particular topic, this survey is one of several tools that'll be coming to you all in the coming year as part of the comprehensive plan process to give you a broader perspective of what are residents looking for in the zoning, development, and planning arenas. So this is the start, and the comprehensive process will kind of give us more finality to what are residents looking for in that topical area.
I guess just one follow-up on this, though, just from the way the question is asked, and this was asking what Parker was asking, perhaps in a different way, but do you really think people are saying, I don't like the development approval process, or I just don't like so much development happening? My sense is that it's probably more just like, I just think this is such a great place to live, and probably, if I think about it, I know we need more housing, but I sure wish there just wasn't more development. That may be oversimplified, but I think that's probably my sense for how a lot of people think about it. It's just a great town, love our mountains, and people, development's fairly unpopular, even though probably intellectually people know that, we do need more housing.
Yeah, that's another pertinent point. I would almost say exactly. I think one thing to also consider here is that you're dealing with a more rural population versus a municipal population in some of these instances as well. So folks in Asheville might have a pretty good understanding of what's going on. Their environment is also probably pretty built out depending on where they live. So major changes in zoning will have major impacts for them. But some of the folks in the outskirts of your county are likely seeing some of that creep as well, coming closer and closer towards them and kind of changing the unique, feeling or whatever it might be of their slice of life in Buncombe County. And so that is another reason why, and I hate to go back to this broken record of communication, but it's more than communication, it's engagement. It's stakeholder groups from the community being reached out to and brought into these planning processes at the onset of them to ensure that we have that community buy-in, but not only what we are doing with the engagement, we're sending out liaisons who have the pertinent information, who have the accurate information, and can help local residents in their little slice of Buncombe County have a better understanding of what is going to happen or what is happening. And then also promote inclusion. Bring yourselves into these meeting rooms and let's have a talk. So I think, another great point, folks don't have a really great understanding of development and zoning. in any community across the country, but they do know when something happens that they don't like, and that's what we see in these results. It's not lapses in judgment by the commissioners by any means. It's just decisions were made. They weren't a part of that decision-making process. They didn't like the end kind of what that decision was, and so they're letting their voices be known. And again, keeping in mind, this is our first survey. So we have a lot of time. Usually we tell folks who do these every 2 years. It sounds like you might do it every 5, or at least reach out with another vendor or with us to residents. And it's important to gauge some of these notes on this presentation and in the report and see how you've compared over time with some of those engagement activities that you might try to implement over the next couple of years.
So I hear what you're saying about engaging the community. However, it felt like as we were working on the strategic plan and engaging a variety of communities, and this was pre-pandemic, so I also understand that, but it seemed like there was really good overall community participation in those. I'm looking at Avril and Tim in those, and that the county really responded to where folks wanted us to come to engage them. I'm wondering how much of this not feeling engaged and saying there's not enough community engagement is really coming because of just where we are in the middle of a global pandemic right now. And if we were to look at this as we transition at some point to an endemic versus a pandemic, do we think we'll see some of this shift and folks being more engaged? I mean, I think even as we think about our comp plan, we had grand ideas and plans about engaging people in person. And now having to shift all of that online yet again changes that community engagement. So I just want to shift and put that in a little bit of perspective as we think about this moving forward, that maybe some of these responses are just simply a condition of where we are as a society right now.
And
I think,
Commissioner, oh, go ahead, Ryan.
No, go ahead, Raphael. I think
So, Commissioner, I think you're right, and that's one of the things why we kind of look at this as a benchmark, right? We'll get results again in the future, and we'll be able to contextualize a little bit. But I'll say, in a lengthy conversation with Lillian, our Communications Public Engagement Director, one of the things that C mentioned was looking at this is really speaking to as a county, we attempt to be more and more intentional and diverse in our engagement efforts through our public input, through engaging a youth and a younger audience. We hope to see these numbers change. So also from a context perspective, this survey was put in the field around November. So we've made improvements, we've made enhancements and greater focus on engagement even since then. We'll continue to do so. So I think you're right to put a little bit of context and disclaimer there. But I think to what Ryan is saying is what we know from the data and from their history at ETC is as we increase our focus on communication, we tend to see service delivery perceptions improve, generally speaking. So even if our numbers were higher for communication, we would still want to increase that focus because that's one area that has a very high return on investment in terms of resident satisfaction with both the community and with county government.
Thanks, Raphael. I appreciate that. And I really appreciate Lillian and her team digging in and saying, there's always room for improvement. But I certainly don't want anyone to feel like they're specifically singled out for not doing a good enough job right now. But I do, Lillian, wherever she is, I appreciate digging in and saying we can always do things a little better. Thanks.
Yeah. No, I would never put it on communication department to be the ones to need to move this forward. I think this is a joint organizational task to engage residents in greater ways. And we oftentimes have special interest groups flocking to the engagement table, but it leaves out the voices of the few, which are really in turn the voices of the many. And I think in the survey results, what we've done is gotten a really good aggregate perception base from all Buncombe County residents. Some of these folks that took the survey are probably part of special interest groups, but a vast majority are likely not to be. And so just kind of keeping their voices in mind can be helpful, and kind of hoping to switch from, hey, you use our website page and get a communication and information about us, to, hey, well, now you're going online to these other sources, you're engaged in our social media and outreach, and also you're coming to meetings. And hopefully, as again, we kind of get out of this pandemic mode, we can start to promote and push some of those additional communication and resources out there to the public to hopefully encourage some participation in local government in Buncombe County.
Hey, we do need to move on in just a moment. I did have just one real quick question, and it's not really to be answered now, but just maybe just kind of express it before we move on. The question about the convenience center facilities. So I'm not really surprised to see the results as they are, because I think, you know, for all the people who already pay for a private service to pick up their stuff, I wouldn't be surprised that a lot of those people would say, no, I don't want to pay more. People come get my stuff. So, but there's a lot of people who don't do that. They were probably more in the, oh, that sounds great category. But I guess just, you know, the responses don't necessarily say, oh, we should go do this. But also, I guess just a question for the staff for the future. You don't have to answer this now, but is having a general taxpayer funding of those centers the only way to do it? Because I guess I was envisioning it perhaps more as like a fee-for-service type of infrastructure, at least to be looked at as one option, as opposed to everyone pays for it and then people use it for free. So I just a question I would have for future feedback. Anything else before we go on?
One thing I want to point out at that, if you look at the map of where the respondents came from, not very much in our rural areas. So it's going to skew those results probably some on that specific question at least.
Yeah. Great. All right. Hey, thank you so much for the updates on this and your great work on the community survey. Raphael, thank you as well. We appreciate it. And it's a lot of information to digest.
We have a few slides that we want to show you about what we're doing now in
Okay.
relation to some of the things we heard just recently. So we'll flip through it real quick, Raphael.
Okay, sounds good.
So just to kind of, we have the survey, so what happens now? So, you know, we developed a strategic plan in 2019, 2020. We've developed departmental business plans, and we've done this community survey to really establish a benchmark and be a key data point in strategic and operational and budgetary decisions. So this is one of many data points that we'll use in making these kinds of decisions moving forward and recommendations. So a couple of topic areas that did get notice in the survey that we wanted to kind of talk about is one, affordable housing and development. We've had a robust conversation about that. We're in the process of developing the county's first ever comprehensive plan. We are going to be talking about goal setting from the Affordable Housing Subcommittee shortly. We've added additional positions dedicated to affordable housing and community development. We have the homeowner grant program, which had a successful first year, and we have the Ferry Road project. So there's a lot of things that the commissioners and staff are doing on the subject of affordable housing. In relation to the economy, we are having an intentional focus on job development incentives to help grow local businesses like East Fork Pottery, Systems Logistic Corporation, Borg Warner, looking at 200 plus jobs and an average wage of $26 an hour. We have the skills training and employment program in Health and Human Services. We have broadband expansion efforts in our county finance department, really trying to work to increase partnerships with women and minority-owned businesses here in Buncombe County. Additionally, in the realm of communications public engagement, we're doing an expansion of community markets, introducing the public input platform. We're adding additional website staffing. We're live streaming board subcommittees and advisory boards, which I'll note very few local governments do. This is something that we really do stand out in. I've never been in a local government that does that. And we're looking at adding a public records portal to make it easier for people to get information about us. In terms of public safety, we've consolidated our 911 system, resulting in a new 911 public safety communications department. You all have added additional units for EMS response, added 18 new paramedic positions, and expanded the community paramedic program. So we will be releasing our results online. We've also established physical copies of the summary reports of the report at every single branch of the Buncombe County Library System. So any resident can go and look at them and see them in there. And we'll be doing a lot of outreach with departments. But thank you so much for your time, and have a good rest of your afternoon.
Thanks, Raphael. All right, next up, discussion about next phase of COVID recovery funding process. And Rachel Nygaard's going to help us out with this.
push down to go to the next slide.
Good afternoon, Commissioners. I'm Rachel Nygaard, and I'm here with you this afternoon to talk about the next phase of COVID recovery funding. My presentation to you will be brief, and this is an opportunity to set the stage for discussion among the board about how you want to proceed into your next round of recovery funding awards, and we'll provide some staff recommendations to you for that. So quickly, I'll do a recap of fiscal recovery funds to date. Then I'll move into just the current status of fiscal recovery funds at the local and federal levels, and then tee up for the Board of Commissioners a conversation around the next phase, which is inclusive of timing as well as process and priority setting. This slide is included each time I come and speak to you on this topic as a refresher for anyone from the public who's following along. This we often nickname ARPA, American Rescue Plan Act, is the overall federal funding bill that coronavirus, state, and local fiscal recovery funds are part of. We call that COVID recovery funding for short. Buncombe's allocation was $50.7 million. There's information here reminding us of the eligible uses of the funds, which span from public health and negative economic impacts to services for disproportionately impacted communities, and so on. I've also included the timeline that we followed so far from when the ARPA, the act, was first signed into law last March, and all of the activities that have occurred since then, gathering input on the use of funds, soliciting project proposals, reviewing those, and beginning with our initial rounds of awards. There's a snapshot here on the slide, and your handout shows a listing of the awards to date. For anyone following along, you can go to buncombecounty.org/recovery funding and look at the awards to date in an interactive format. That's what the commissioners are looking at on paper. There have been $22.3 million of awards so far. And this shows how many projects and the percent that are community-led versus led by county departments. This is another look at that community versus county department-led. There have been 61% of the funds so far invested in community-led projects, so funded to subrecipients, to nonprofits or public partners who are leading the projects. There's also a look at investments by category. We will revisit some of this later when we look at the priority setting conversation. Services to disproportionately impacted communities is the largest area of investment so far, with affordable housing being a primary driver there, including both housing and homelessness services. All of this is to lead up to where we are now, which is having $28 million roughly left to award. Current status at the local level. As you know, we added grant managers. We have 2 grant managers working full-time on this, and they are working with each of those projects, whether internal or external, finalizing all the award agreements, working on monthly reporting and monitoring, and supporting those, particularly those outside partners, as needed with capacity building support to be best prepared to have the capacity to effectively manage these federal awards. The great news at the federal level is that we have a final rule. You heard staff over and over throughout last summer and fall and beginning into 2022 saying we are waiting on the final rule. We operated for a long time under an interim final rule from U.S. Treasury, but as of January 6th, we now have a final rule. In summary, the final rule gives us more flexibility. We have the ability to use up to $10 million for any general government service, so it does not have to necessarily fit into one of those pre-described categories, the ones that started with public health and went to negative economic impacts, et cetera. We do have an answer on an important question that we were waiting on related to fund capital. We have the authority to fund capital as well as any programs or services for allowable categories. That was an area that we'd spent some time talking about in the fall. And we have clarification on the staff side on how each of these agreements can be structured when it comes time for awarding and deciding performance measures and reporting back. So here's where we're at with recommendations. Staff would encourage the commissioners to select priority areas for the next round of awards. Provided that the board can give us as staff some priority areas, we then can go and solicit project proposals. There are some proposals that are still on the table that we could go back to for updates that might have been submitted by community partners or county departments that might fit with the categories, or we could include new proposals since some time has passed since the June-July timeframe when the original solicitation was open. And we would look to follow essentially the same process that we have followed in the previous rounds, where staff score and review the proposals and commissioners ultimately determine the awardees. So here's what a timeline could look like. If by the end of February, we've got some priorities selected, we can solicit those proposals and have those in by the end of April, conduct the review, and be ready to move into the award for the next round in the July-August timeframe. This has all the stars on it all at once instead of animation, but I'm going to talk you through this. So when we were first notified of these awards last spring of 2021, the Board of Commissioners brainstormed, had a work session coming up with some example priorities that maybe the funds could be used toward. And that's what's in the background on this slide. It was organized by the strategic plan focus areas. So from left to right, you see educated and capable community, environment and energy stewardship, resident well-being, and vibrant economy. Layered on, it looks like we're missing the latest layer, but layered on is the highlighting those that came out as top priorities in the community survey. So when I say the community survey in this context, it was the survey we did in May of 2021. The top 5 areas that were highlighted from that community survey in yellow were K-12 education, affordable housing, homelessness, mental health, and workforce. We have the ability to layer on the top priorities that came out of the survey we just heard prior to this, and it looks like in our technology that didn't make it to the screen, but we'll send that to you. We also layered on this green star, which is those top 5 priorities that came out of this Board of Commissioners budget planning retreat, which occurred in December of 2021. So if we narrow down and take a look at just those that were highlighted through the community survey and the budget retreat, it's a shorter list. And the information in front of you gives a sense of how much we've invested so far in some of these areas. Want to remind you of the guiding principles that the Board of Commissioners established at the outset. Keeping in mind the alignment to the strategic plan that Buncombe County has adopted, balancing community-led and foundational projects, prioritizing equitable outcomes and support for most impacted populations, looking for opportunities to collaborate intergovernmentally and leverage other funding sources, considering the one-time expenditures over recurring, and making sure that projects fit within time frame. So with all of that said, the discussion or question that staff would bring to the board is the draft priority list as a starting place. Are there any items that you would want to add to that list that are important to you, that you think makes sense for consideration for recovery funding? Are there any that are on the list, while they might be a critical priority for the county, maybe you wouldn't recommend that they are on the priority list for the next round? Maybe because of investments that have already been made, or maybe because of other funding sources that exist. Edit is if we wrote something and it seems too broad or too narrow, we can tweak that. And then ultimately, amount. It would be great to select the number of priorities and have an idea of how much the commissioners intend to budget for each category. So thinking about this list from the lens of add, remove, edit, or amount, we open discussion, and I'll leave it on this slide in a minute for the board to have that conversation. I'll quickly point to next steps before we go back there. We have the ability to come back at your next briefing meeting when there's more time on February 15th. There's a tentative placeholder on that agenda, so if you'd like us to give you some more time for this conversation, that's a date that we can do that. And then ultimately, once we get that priority area, staff will be ready to develop the request for proposals based on those priorities and engage with partners and the public about where we're heading next. Any questions for me before discussion amongst the board?
Just so I understand or get an idea of your hope for this exercise and I guess the consequences of adding or removing things. The goal is to create a list that we then share with the public to receive applications in return. Is that?
It is.
Kind of narrowing the scope here. Okay.
The rationale for the recommendation, Commissioner, is that the first round of solicitations was very broad. So we got a lot of project proposals covering a lot of territory. Knowing that we have this amount left, it's our thought that selecting some priority areas to focus on would allow us to be more tailored in the approach to investing those funds and help the commissioners get that long-term sustainable impact you're looking for.
Okay. Thank you.
Just to kick off the discussion, do you mind bringing back that slide? I'll start in an educated, capable community. I think that the early childhood and the K-12, there's actually sort of a bridge between those two. As we've talked about strategic priorities through our strategic plan, kindergarten readiness is one of those top goals, which is really kind of that bridge between early childhood and K-12. And I just briefly am very excited to share some news from our early childhood committee. This is hot off the presses that this afternoon when we met, the committee unanimously endorsed a set of strategies related to pre-K expansion that are articulated in a report provided by Buncombe Partnership for Children. I know we'll be talking about this at our next briefing meeting, but just want to kind of share that news with the full commission with a lot of excitement, I think, from the committee, and also really elevate that from the start of this conversation as a place that it feels like it would be a very compelling place to invest ARPA funds around a 2-year pilot initiative, for instance, to really accelerate our work around pre-K expansion and hit both the early childhood and the K-12 and arguably some of the workforce development goals we're trying to work on as well.
Max, can you put up the slide with the priorities? Thank you.
And Commissioners, as Rachel mentioned, we will bring this back at our next meeting as well. So if you want to just take a moment to think about this, and we can talk about it in more detail. Or Brownie, if you want to put your item, depends on how you want to do today. If you want to put this off until next meeting and get to your items.
Let's definitely plan on talking about this more. This is so important. This is a lot of investment. So let's plan on talking about it at the next meeting as well. But if people have any just initial thoughts, I think it's fine to spend a couple minutes just with initial comments on it.
Yeah, I want to make sure as we move forward, we're looking at our aging population, our 65 and over.
I think we know the impacts of COVID on that population. It's been a priority in our strategic plan. And yet, throughout this process, I don't think we've really considered the needs of our aging population. And I think that in many of these categories, there are some ways that some of that crosses over. I specifically think about affordable housing and the relationship between our 65 and over population. So I just want to make sure that we're not leaving any groups of people behind as we move forward in this process. And I think looking through the list, we've probably not done enough to care for those folks in our community. So I'd like to add that for consideration.
I'll just, thank you for this information, and I think that this is a good way to go with priorities and being able to be more focused. And my only initial thought to share right now is around, I personally don't think we should go ahead and limit the funding in each category. I think that what will be better is to actually see the quality of the projects that come to us. And if we artificially already said so much per category, then that may not end up being the best use of those funds. So I feel like doing the priorities is a great idea, but not doing a specific amount of funding per each of those priorities.
My reaction is that I kind of like the list as it is roughly in terms of how narrow it is. We'll get a lot of applicants just out of that kind of list, but I think it's a good size net to capture some good applications. The only other suggestion I would have would maybe to add some more of our thoughts in fine print to each of those bullets in terms of what we'd love to see in the back of our heads.
Mm-hmm. All right. Other comments?
But through all of this, let's not lose track of equity and inclusion. I think that's critical, folks. We've got to continue to do the work that we're doing, and let's not drop the ball and get lost in the process. And that should come in with everything we do anyway.
I agree on that. I support that very much.
I think the only area that I would advocate for including under the vibrant economy, we did a number of things in the first round with like small business equity and small business loan support. Yeah. And I thought those were some of the strongest proposals we had.
Yeah.
I know it hadn't been that long, but I'd like to just kind of continue to look at that space. There were a couple of projects that I thought perhaps we do an initial round of funding, perhaps consider additional funding for even some of those same projects to kind of, potentially give them some additional resources to, for future work. So that would be one area I'd like to have an openness to funding. The only other comment I have just in terms of the schedule, overall, I think the schedule is pretty good, but I do have concerns, and I know there's time limits and all this, like the funds have to get spent, but like, the area that I'm probably most supportive of in terms of investing is in the affordable housing space. But I do have concerns about, some really good proposals and projects I don't think can be developed on the time frame, on that short time frame. Because some of these are big, complicated projects. So we might want to think about maybe some different planning horizons for different categories for some of the ones where you might want to have a little bit more time to make sure you're not excluding certain types of projects that might need a little bit more runway to get, well prepared to submit. So just a thought on process I would share. All right, any other comments before we move off this item for today? And we'll talk about it again at our next meeting.
I just have it similar a little bit to what you're saying about projects we looked at or we funded last time and wanting sort of status updates. I'd like to hear from the community paramedic program sort of where they are in their scale. And they had proposed sort of a multi-pronged approach to us and just get an update from them about whether they would be ready for another infusion of funds if it were available and what might do, particularly around mental health and homelessness issues.
Okay, great. Rachel, thank you for putting this together, and I think it sparked a good conversation. We look forward to fleshing it out.
Thank you, Chairman and Commissioners. To be continued.
Yep.
Thank you.
All right, commissioners, we've got just a few more minutes. I don't think we're gonna get through our full agenda here, but we can, let's talk for a moment about the performance review scheduling, because I think it's just gonna take a moment. There were some emails about this. So let me just summarize kind of what I was hearing as kind of maybe the sentiment, which is that we would be on a schedule to do our full formal performance reviews for the staff who directly report to the county commission after the approval of the budget process. We get through with that, and then we would do it like in July, maybe July, August, right? So maybe we start it and probably have a couple of meetings to handle that. So July, August, basically post-budget, we would have a couple of meetings with the direct report staff to do that. But that we would also do just an informal kind of check-in meeting with all of our direct staff reports in the near future. So in the next, say 4 to 6 weeks, we would do a sort of a more informal check-in with them. So that's kind of what I was hearing, and I just wanted to see if that sounds like a good approach to everybody. And if so, then we'll plan on that being our kind of schedule going ahead. And with that schedule for our annual review process, also, like, we will keep it consistent that way unless we decide to make it different. So post-budget timeframe for an annual review for all our direct reports, and then like a mid-year check-in, which maybe in subsequent years we would actually do a little bit earlier, so it's more like mid-year. Does that sound good? Are there any comments on that? All right, well, very good. Well, we'll take next steps to start setting up the informal check-in meetings. All right, so we don't have time now for the affordable housing presentation we wanted to do. So I guess we have a couple of options. One is the overall agenda for our regular meeting is not, I think if we are focused, it's not going to be super long. So we could move this item just as an informational presentation to the regular meeting agenda. Or we could put it on our next briefing agenda, but if we could put it at...
What's the preference of the Affordable Housing Committee members?
It's a purely informational meeting, so we're not asking for any big, decisions, but I think we have some information we're eager to share about some of the goal-setting process.
I'd like to see that so that can inform our next discussion about ARPA, personally. So I would love to do it at our 5 p.m. agenda. if that is okay.
That sounds great. That sounds great. Oh, so just looking at our agenda, we'll do it under presentations. Very good, perfect. All right, thanks. Well, let's take a 5-minute break and we'll start the regular meeting at 5 o'clock.